joined by my colleague, John Cullen, who is from the technical service department doing cataloging and such. And we're happy to welcome today Dr. Jessica Zucker, who is the author of this book, I Had a Miscarriage. Jessica is it's a psychologist or a psychiatrist?
I'm a psychologist.
Psychologist, specializing in reproductive mental health and maternal mental health. And we're very happy to have you here. Thank you for joining us.
Well, thank you so much for having me. This is such an honor.
Just to start out, and without giving too much away, I was wondering if you could tell us a bit, especially for those who haven't read your book yet, a little bit about your backstory and what led you to write the book, and to start the hashtag I Had a Miscarriage campaign online.
Sure. Yeah. Okay. So as you said, my name is Dr. Jessica Zucker. I am a Los Angeles-based psychologist specializing in women's reproductive and maternal mental health, and have done so for over a decade at this point. So I think a lot of people sort of assume that I started specializing in this because something intense and life-changing happened to me, but actually my story is the opposite. I specialized in this namely because I was passionate about women's issues and women's rights. So long ago, I pursued a master's degree in public health and wanted to work in international women's health, and did so for a time. And so when I pursued my PhD in clinical psychology, my idea was to sort of marry my background in public health with the clinical, focusing specifically on reproductive health. And again, at the time, no background in pregnancy loss, none of the issues that I specialized in. So I launched my private practice after years of study, and I was 16 weeks into my second pregnancy when I had a miscarriage. And I had a miscarriage in the context of my home. I was home alone and the baby emerged. So I guess trigger warning for people watching. Of course, most people know that a majority of miscarriages take place within the first trimester. My miscarriage in that way was quite traumatic, dramatic, and I guess you could say abnormal. And suffice it to say that the intensity of this experience kind of shifted my life lens for good, including, of course, my work life. So I had been, as I said, sitting across from people, hearing them talk about wanting to get pregnant, wanting to stay pregnant, what it was like for them to emerge into the postpartum period, struggling with perinatal and postpartum mood and anxiety disorders, terminating wanted pregnancies, and the whole spectrum. And I listened intently. I had read every book that exists within my field on these topics. I had attended, conferences and seminars and had supervision. But until that day, October 11th, 2012, it really was all theoretical for me. It was not corporeal, meaning I had not yet lived through something that rendered me truly able to understand their lived experience until I was able to. So this is the long answer to your question. This sort of gave rise to a passion in me, that already had existed, but, I really felt like, wait a second, how is it that a majority of women are reporting feeling a sense of shame and self-blame and guilt in the aftermath of loss, right? So that's, in the research, we've found that. And I fortunately, I didn't go to those places after my loss. And maybe it's because I had had a healthy child previously. I don't know exactly why. But I just got this like burning desire within me to address this. And so I don't know how long after my miscarriage, maybe a year. Well, I launched the I Had a Miscarriage campaign in 2014. So that was technically 2 years later. But I just started, writing endlessly on the topic and really like almost begging women to question these notions of global silence around this ubiquitous topic. And so I wrote and wrote and wrote and wrote. And then eventually it just seemed time to actually write the book because, it was time. That's the long-winded answer to your question. Here's the book again. Oh, you can't see it. Oh, there we go. Okay.
So as you were talking about, I also have quite a few family members and friends who have had miscarriages, and I'm always so surprised that it's not discussed more openly just as a society. I know when parents lose a child from infancy up, everyone mourns it and everyone rallies around these parents. Why do you think there's such a stigma there?
Yeah, no, I mean, it's such an important question. And it's one that kind of enrages me at times because it's sort of like, what is the deal? Why can't we get on board? So I think that, you just raised such an important point. When people actually know the baby or the person or the grandparent, somehow our culture seems to have a little bit of a sense of how to navigate loss and grief. But we have yet to even touch upon what it means to lose and subsequently grieve a pregnancy. Why is that? Is it because nobody else knew the baby? Is it because it's so uncomfortable? It's so unimaginable. It's so almost egregious to kind of sink into those feelings of losing something that somebody wanted so badly, right? But then, unfortunately, what we do oftentimes is we then rely on completely outdated, I don't know if they were ever in date, but completely sort of heinous platitudes. Oh, at least, you can get pregnant. At least you have a healthy child. God has a plan. Everything happens for a reason. Not to worry. You'll get everything that you want. You always do. All of these various things that I think actually people are telling the griever because actually they're talking to themselves. I think that when we say these kind of cliched platitudes, we're trying to shore up the uncomfortability surrounding death, surrounding untimely loss, surrounding, the painful grief. And so I think in a way, what the culture sort of works to minimize the complexity of these very losses. And, of course, I am not one to compare and contrast grief, which I take this on in the book a bit. I think people get tempted to be like, well, at least you were only 7 weeks. That has no bearing on how people feel after they've lost a wanted pregnancy. So somebody could lose a pregnancy at 7 weeks, at 17 weeks, at 40 weeks. We don't need to compare them. Everybody is entitled to their feelings, of course, and everybody is entitled to take the time they need to grieve. Right. So I think that sometimes people, again, like you said, it's like, okay, well, if like a child dies, everybody, surrounds the family and huddles close, provides unending support. And yes, one could argue, of course, knowing this child, that's enormous grief. but we don't, again, we don't need to get into like grief Olympics, right? No one wants to be the one that wins, standing on the mountaintop saying like, mine's the worst, you know? And if you read my book, you know that I sort of try to get at that, you know, analogy. It's sort of like, no one needs to win. No one needs to lose. We're all just, you know, trying to do our best through something that we never thought would happen to us. So I think the stigma and the silence really drive home a sense of shame. And I think that is, you know, the guilt and the self-blame are byproducts of living in a society that is so fraught with silence. And then it's stigmatized. So, you know, it's like, as I get into in the book, it's like a trifecta and it swirls and you kind of can't figure out which thing comes first, right? So does the silence lead to shame? Does the shame lead to stigma? Does the stigma lead to shame? It's like, you can't kind of figure it out. But what we do know is that if we actually spoke about this difficult topic, people would feel less alone and less isolated and less self-blaming. You let me know if I'm going on too long in my.
Oh, you're good. You're good.
Okay.
Did you have a question for Jessica, John?
Yeah, I did. When you first experienced the trauma of the miscarriage that you describe in your book, you know, one of your reactions after you were, you know, like over the initial trauma was to pick up your practice, pick up living with your family, going on with your life, and trying to, I guess, convey a semblance of normalcy,
Yeah.
especially to your patients. And that didn't really work for you. I guess the term you used was compartmentalize. And I was wondering if you could go into that a little bit more and explain why it didn't work for you and what happened that got you to change.
Thank you. Yeah, it's such an important question. It's such an interesting thing to think back on right now, given, you know, this kind of the global pandemic and how it's shifted my practice in general, right? So it's like, I haven't seen patients in person in so long and have since gone through another trauma, which we can talk about later if we want to, but, you know, I haven't had to deal with that in real time in the same way as I did with the miscarriage. So, right. Yes, you bring up something so important, which is to say that I do think that even a psychologist, you know, even somebody that's well-versed in mental health and diagnoses and feelings and trauma effects and all of these things, I think as humans, we try to keep going, right? The adrenaline, I think, of my loss, you know, the adrenaline of giving birth, let's say, because I did, you know, technically give birth, sort of propels us, and trauma propels us to keep going, keep going, keep going. One foot in front of the other, keep things together, keep moving. Why? Because it's like, when we don't, I think we actively fall apart. And I think that in some ways, it's really protective to try to keep going initially. I mean, hopefully at some point, people allow themselves to really feel like, let it all wash over them, you know. But I think number one, I had, you know, a young child at home. I think my son was about 3.5 or 3. And I felt very sort of, I think, afraid to allow myself to sink, because I wanted to actively mother him and I didn't want him to kind of have an association in his mind, like his mother's just like crying in bed. So that was one thing, but that's not connected to my patients, of course. But I think it's like along those lines, that was sort of like, all right, keep things moving, get up and go, you know. So as you know, like in the book, there's an interaction between me and my sister where she's sort of convincing me that, Jessica, you've got to slow down. Like you have to email your patients to let them know you're taking a week, whatever. And I thought I truly, I mean, it's kind of almost embarrassing to say that I truly thought I was okay enough to go to the office. And again, part of that was like me trying to keep going, like I said, but also I think I feel a real sort of loyalty to my patients and to my work, and was afraid that I didn't want my difficulties, my life challenges to kind of bleed into the office, and particularly because a majority of my patients are dealing with the very thing that I just went through. So it's sort of like, it was mind-boggling to try to figure it out. It's like, okay, so if I show up for them, then we can get back to the business of them. Also, perhaps, does it model for them that I am okay, that life moves, that I'm not sort of rendered, depressed or anxious to the point of not being able to work, whatever. Anyway, all of this to say that I was kidding myself, but didn't know it at the time. I mean, it was like a genuine desire to show up. But it wasn't until I was there and, each successive, session brought up so many different feelings for me. It's like one patient, would talk about sort of like now her fear that this is going to happen to her. And I was like, wait, what am I doing here? Like maybe me being across from her is actually detrimental to her growth and mental health and to her pregnancy, not the actual pregnancy, but just like to her state of mind around the pregnancy. So it wasn't until retrospect, though, that I felt like, wow, that was a mess. And yet as a human, I was doing the best that I could. I did what I thought in the moment was best for my patients, good enough for me. And because there's no cultural conversation, and there aren't books for therapists on this topic specifically, or there weren't until mine came out, but I just even mean clinical books, like what to really do, how to process it. Like I was lost. So I was just making up my own rules, I guess. Yeah.
That kind of leads into a follow-up that I had. You had a description of you went to have your nails done, and you were speaking to the person at the nail salon, and you actually told them about your miscarriage, and they shared their own information. And I got the sense that was kind of liberating for you at the time, and that it really kind of like added to the impetus for you to write this book and to speak about it.
I love that you remember that scene. That was honestly a turning point moment in like my post miscarriage, or not even a turning point. It was I had an epiphany. That's when it coalesced how traumatized and almost dissociated I felt. So yes, I had scheduled, trying to like get back to my regular life or whatever. I scheduled a manicure and pedicure with the person I had been seeing for a long time. And when I got there, I didn't know how I got there. Which, I mean, I don't know what to say. I don't know if, again, it could have been the postpartum hormones that maybe I didn't sleep well. And so I was so sleep deprived, and maybe in my grief, I felt lost. And so, yeah, I called my husband from the chair and it was sort of like, you have to come meet me here because I'm so overwhelmed and so confused. So that was wild for me. It was at that point that I realized like I needed to dig deeper and sort of let myself fall apart. But yes, Joanna, who no longer works there, she moved back to Romania. but there was, you know, kind of this beautiful intimacy between us, as I'm sure a lot of, you know, people in her work feel with her clients. And I had always, you know, shared with her about my son and about my work and whatever. And she knew I was pregnant and I had to share this with her. And I, of course, hadn't known before that moment that she too had lost a pregnancy. And yeah, that was a turning point in terms of sort of noticing just how profound it can be to share your own story, right? Because no one's walking around with a shirt on that says, I had a miscarriage, although I wish they would, but that's another story. So we don't know until we open up ourselves, until we sort of muster the courage to reveal our vulnerability. We don't know that of another's, you know? And so, yeah, I felt closer to her. I felt like there was just such a sort of, you know, mutual knowing and understanding in what it means to go through this pain, what it means to be a woman, what it means to, you know, go through pregnancy, what it means to lose something wanted.
So beautifully stated. Before the next question, I just wanted to make sure everyone who's watching knows if you have any questions for Jessica, please feel free. Either you can put them in the chat or the Q&A at the bottom of the Zoom screen, or if you happen to be streaming this on Facebook, you can write a little comment and it should get to us. So I wanted to talk a moment about rainbow babies. I had never heard that term before reading your book. And I was just wondering, for those watching who might not be familiar with it, what's the meaning behind that term and the sort of the significance of rainbow babies for parents and families, and how they sort of in their own way honor the memory of the baby that was lost.
Yeah, thanks for bringing that up. It's actually interesting because it's sort of a controversial term in the loss community. Some people do not resonate with it. So here's how I think of it. So a rainbow baby is a baby born after a loss. Some people, though, so I see it like, you know, this is something that came afterward. I think there's a misunderstanding, though, within the community, that it means that the loss was the storm, meaning that baby was a storm and now this one is a rainbow, which I think, you know, I understand if you think of it that way, why it's actually, you could kind of shudder, because obviously our traumas are not storms. I mean, it's a stormy time, but it's not, you know, it changes us, which some of us wish we were never changed. Others embrace, you know, the fact that life happens and we have to roll with it and incorporate the changes we go through. So, you know, and I think that sometimes people feel uncomfortable with this term as well, because what if you don't get a rainbow, right? So I like to kind of reiterate, not everybody gets a rainbow baby. You know, plenty of my patients, unfortunately, do not go on to have another, or maybe they go on to have another pregnancy, but they don't necessarily go on to have another baby. But I think it's an important way. So in, I think 2016 or 2017, my campaign sort of focused on rainbow babies and rainbow, like I created t-shirts, and that was sort of a way for me to normalize the conversation all the more. And I thought, how cool would it be if two moms, you know, recognized each other, someone's wearing the shirt and somebody goes up to her and says, oh, I too went through a miscarriage or a loss, or I understand, you know, what you've been through. And my hope there was really to ignite an intergenerational conversation around loss. Because again, like we were talking about before, like sometimes until we share, we don't even know that there's a history of miscarriage or stillbirth within our own families. Your aunt, your grandmother, your great grandmother, your sister, even your sister-in-law, you know? And so I think that when we talk about rainbow babies, I hope part of the aim there is to acknowledge I've been through challenge and here I am. Now, I want to like impress upon listeners, you know, rainbow babies, the birth of a healthy child in no way diminishes what came before. And rainbow babies, of course, this goes without saying, rainbow babies are not replacements for the baby who's not here. Do we sort of, you know, do some of us sometimes ponder, you know, like, wow, you know, and I know I do, and I say this in the book, and I think this actually a lot when I'm interacting with my now, you know, rainbow baby daughter. I think to myself, she wouldn't be here if the other one made it. So that's like a very, you know, complex thing. I mean, that's all of us wouldn't be here if our parents didn't do what they did at that very moment, you know? So it's like, it really gets you thinking about, I mean, it's awe, really. And it doesn't in any way, and I reveal this in the book, if anything, like I held my breath through my subsequent pregnancy with my rainbow baby. I was so on pins and needles. It was so uncomfortable. So until she made it out, you know, and was crying and suckling and whatever, I didn't believe she would. In part because of what I went through, of course, but also because of all the stories I had heard from patients, right? So they seeped in deeper after my loss, you know, the ones about stillbirth, the ones about learning at 20 weeks they needed to terminate, that, you know, things that hadn't happened to me. I was like, well, who knows? Maybe that will happen to me now. But as I talk about in the book, my anxiety actually did not diminish when my daughter was born, to my complete dismay. I mean, I was like, I thought, you know, okay, she'll come out, I'll cry or whatever I feel, and I'll embrace this next phase. But instead, I felt I wasn't a sort of, you know, the stereotypical kind of discussion around postpartum anxiety is like hovering over the crib and being worried they're, you know, not going to wake from sleep. I didn't feel that, but I just felt a very uncomfortable awareness of my mortality in a way I hadn't before. And was it because now she was earthside, she was here, this was the end of my pregnancy journey, and now I had two babies to protect and raise, you know, and so, and, you know, and I could now finally take a deeper breath or an exhale because she was out and I didn't have to live in the mystery of pregnancy anymore. And I could grieve what I kind of wasn't fully grieving because I got pregnant so quickly after my loss. So it was just, you know, messy. So all of that to say that, you know, I think people oversimplify this kind of like, yay, you got your rainbow baby. And it is wonderful. And people feel maybe, you know, again, like they can breathe more deeply and they can celebrate in a new way. And maybe for some that really sort of does put their loss in a different place for them. But many people still want their loss acknowledged, their loss memorialized, ritualized even, you know, this is when I say some of these things, I'm referring more to later losses, you know, because somebody who has a stillbirth, they may want to incorporate that lost child into their life forever, right? They may want that photo of the dead baby, you know, in all their family photos, for example. So getting, a live child does not in any way, it doesn't remove the trauma, and it doesn't remove the heartbreak.
So we have a question from a viewer. Katie asked, and this sort of relates back to a lot of the do's and don'ts in the book and what you mentioned before about platitudes. How can or should we comfort a friend or family member who's experienced a miscarriage or a stillbirth?
Perfect. Oh, good. I'm glad you asked. Okay. I find it, I kind of like to start with what not to do for some reason, because I feel like actually what we can do to support people is super simple, which is so heartening to think of it that way, right? So we kind of complicate it and we get lost. So what is not something that most people want to hear after a loss is everything happens for a reason. God has a plan. God doesn't give you more than you can handle. That one deserves a pause. At least you can get pregnant. At least you're young. At least you have a thriving career. At least at least you already have a healthy child. We don't benefit from any sentence that starts with at least. I think. I mean, I haven't thought through every sentence that starts with at least, but what we're actively doing when we kind of invoke God or religiosity or this at least stuff, we're actively minimizing an experience, and we're projecting. We are assuming that the person believes in God. We're assuming that, the other person sort of holds similar beliefs, which I think is can be so damaging. But also when you really think about it, at least you can get pregnant. So what? You could get pregnant and have 15 losses. So getting pregnant for some people isn't the hard part. So saying at least you can, what? That's number one. Number two, you're not a doctor. So I think it's just so important to kind of step back from this kind of like taking on a reproductive endocrinologist role and saying something like that. Oh, you're so young though. What? Who cares? A lot of people, go into, are sort of going through ovarian failure or something at like 30. So we just can't make assumptions. We can't know. And I think, again, that's just so uncomfortable for people not to be able to kind of have some answers. But here's the good news. We don't need to fix anything. We don't need to kind of actively try to ameliorate grief. All we need to do is engage and support. And what does that look like? I'm here for you. I mean, so I think we just put our feet in our mouth because we are so uncomfortable. But when you think about it, the most loving thing we can do is to show up, be present. That's it. So, I mean, if people are asking for like actual words you can say, I'm so sorry for your loss. I'm here for you. And then I'm very kind of dead set on the importance of consistency. So I had people that were so there for me in the very beginning, and then out of nowhere, they were gone. So I think, depending on the person and of course the circumstances, oh my goodness, what a difference it makes to follow up after a month, after, 3 months, 6 months, a year, depending. Again, maybe some people don't want that. But what we can't say is, I didn't bring it up because I didn't want to make her uncomfortable, or, oh, I didn't want to make her sad. But that is an excuse. asking somebody about something they went through that lived, like that was within their body, is not going to suddenly throw them into a terrible mood. They are very aware of what they've been through. And they can say, you know what, I don't want to talk about that right now. Or actually, I'm doing well. And like, I just can't even go there. They can say that. But if we assume it, I think it's just an excuse, a way out of engaging and asking people about their lived experience. Does that answer the question though?
Yeah.
Oh, I mean, and then also, of course, like people can do things like they do for funerals, like, you know, send flowers, send food, send a card. I made a line of pregnancy loss cards for this very reason. So tangible things like that, you know, can be very helpful too. And especially again, in a later loss situation with the stillbirth, infant loss, you know, the family may really need sort of help with logistical things. And it would be, you know, so wonderful and so helpful to receive, you know, food and comfort that way.
Excellent suggestions. Thanks so much. I want to just talk really quickly. The book and your I Had a Miscarriage campaign both sort of emphasize that it's never too late to grieve and memorialize the baby in your own way.
Yeah.
I know in the book you talk about how you found solace in your trip to Japan. But there are so many other ways that parents and families have memorialized their losses. Could you talk a little bit about the significance of this and its part in the healing process?
Sure. Yeah. So I think, you know, again, because there is such a lack of a sort of, there's no apparatus in our society for these losses, right? So, you know, as I talk about in my book, you know, in Japan, it's part of why I went, you know, I wanted to see grief being embraced in real time, out loud, in nature. And because, you know, they had this garden that I talk about, you know, in the book, and it was wild to just sort of, you know, any day of the week, anybody can just go pay homage, go, you know, meditate or reflect or cry or, you know, bring gifts or burn incense or whatever they're doing, integrated into life, integrated into, you know, maybe somebody is on their way to work. Maybe this is like part of their commute. And I felt envious of that. I felt like, wow. I mean, if I had it in me, which I unfortunately don't right now, but I mean, I definitely toyed with the idea of trying to create something locally. And maybe I will eventually. There is supposed to be, I don't know when it happened, but maybe a couple of years ago now, maybe more. There's supposed to be a garden in San Francisco that is dedicated to lost babies. So people are ritualizing and memorializing in many ways. And yet it's like, wouldn't it be nice though, if there were some, you know, standardized ways or places people could go? So I have patients, of course, who have had stillbirths and infant losses, and they have a headstone, or they have ashes, or they had a ceremony. But for people with earlier losses, they're sort of like, and I wasn't offered, because my loss was at 16 weeks and stillbirth is considered 20 weeks and onward. I wasn't offered any of this. I didn't get footprints or a lock of hair or ashes or any of that. And so I think those of us who want somehow to kind of honor this experience, whether it's really honoring the baby and or honoring just how, you know, inside out changed we've become through this experience, we're kind of at a loss. So as I've written about, I think I wrote an article, I think it was for Elle magazine, sort of the ways in which people ritualize. So many people, plant trees or get tattoos or create their own sort of ceremony, or even have like jewelry made either with the baby's name or, with a lock of hair or ashes. But we don't have gathering places. Not yet, anyway. Not, sort of, again, not enough of them maybe. And so I think it kind of leaves people at a loss for words and for action around wanting, really wanting others to be able to see, or even, again, just for themselves to be able to show, like, this is what I've been through. I would like a place to go where I feel recognized.
Did you want to take the next question, John?
Oh, he's muted.
Having problems with my mute button. Sorry. Can you hear me?
Yes.
Yeah.
Okay. One of the questions that comes up, and actually that I wanted you to talk about a little bit more, is pain, physical pain. The pain you had as a result of needing to go through DNC after the miscarriage, and then you bring it back with the birth of your daughter Noah, and you refused meds to numb you during the birth process. I'm thinking Pitocin or something, I don't know, but that was very important for me. And you used the phrase, pain is purposeful.
Yeah.
I'm wondering if you could just speak about that.
The level of detail, like the fact that you pick up on so many sort of important nuances in the book. So thank you so much. It's like bringing me to tears. Because I haven't read the book in quite some time. So thank you for that. Yes. So the pain, the physical pain associated with my miscarriage was extensive. That morning, I had started spotting on a Tuesday. I felt pretty okay on that Wednesday, but then that night I was roiling in pain. My friend came over, who's a midwife, to check the heartbeat. Everything was fine still. And I had gone, of course, to my doctor. Everything had looked perfect. But the pain, of course, made me think there was no way this was going to have a positive outcome. And the blood increased. I tried to do everything I could, take a bath, all the things to kind of calm my body and lessen the pain. And then, I don't want to freak people out, but when I was getting ready to try to go to see the doctor to get more information, even though there wasn't really more information I could get, but I still wanted to try. And I was trying to get my pants on, and I started to have like what felt almost like a panic attack. And now I realized that I was like in transition. I was about to give birth, and so it was just like wet-faced and dizzy-ish and just overwhelmed. So I went to the bathroom to just sit down, and I thought like a cool compress and, emptying my bladder or something. I didn't know what would calm me down, but I was just trying because I was home alone. And I went to the bathroom and I went to urinate, and that's when the baby fell out. And so that pain, the physical pain leading up to it, and the subsequent relief I felt when she came out was stunning. Not that, of course, I didn't want that to happen. I didn't even imagine that could happen. I'd never heard a story like this in my life, but it's like, that the pain leading up to birth was so all consuming. And nauseating almost, and so once she was out, it was like I instantly did physically, I guess, feel better. But then I had to, do what I had to do after that, which was just, next level trauma. So yes, so when I was pregnant with my son, I was really open to the idea of not using medication in the birth. But, the labor wasn't really progressing as they call it. And I, at some point, just decided, we need the Pitocin and I would like the epidural. After going through the unmedicated miscarriage, and then, as you said, so my husband obviously came home immediately and we got me to my doctor's office. And basically I was faced with this, I guess, decision, if you want to call it that, to either wait for anesthesiology and need a blood transfusion, or have an unmedicated DNC right there, right then in her office, amidst like a sea of blood, because I had a blood clot by the time we got to her office. I mean, the whole thing was a mess. And honestly, at that point, I was like, I'm in so much emotional pain. Like, what? I can take it. Let's just go, because she said at the most it would take, 10, 15 minutes. And basically, the DNC, it's like she needed to get the placenta. She needed to get the rest of the pregnancy out, so that I would stop bleeding. And honestly, yeah, I mean, the physical pain of that, it's this tugging sensation. And I think, to be honest, it was the sound of the DNC machine and knowing what was happening that was excruciating. This was the end of this pregnancy. And so when I went on, I think 4 months later, to get pregnant with my now daughter, I felt like, wow, if I was that unfortunately present, physically, emotionally, everything, through my loss, how profound it would be to be this present for the beginning of something beautiful, a relationship. And though I go into birth open, like I don't want to go into trauma just because it would be great to not use medication. Like, no. And I'm not anti-medication. As I just said, I used it, with my son. And I did it. And it was transformative. And I love talking about that with my daughter. And I love that the physical pain of her birth didn't ever edge into trauma. There was a moment where I was like, if I lose focus, I'm going to freak out right now, because it gets so intense, but I was focused and hopeful that this was the beginning of something new.
Thank you so much, Jessica, for sharing all these very open and vulnerable and raw stories. It's really refreshing to talk to people who are so open about what they've experienced. And I hope that this helps us sort of shift the culture around so that more people can be more vulnerable about this. I want to be respectful of your time. So we're going to wrap it up over here. Again, the book is called I Had a Miscarriage. We have it available here at the library. If you happen to be zooming in from somewhere outside of New Haven, it's I'm sure available at your local bookshop off of Feminist Press. And we were so honored to be able to chat with you. I have a bunch more questions, but it could take, all well into the afternoon. So I'm going to cut it.
No, I'm
short for you
so much. I mean, this has been really kind of emotional for me. And as I mentioned before we got started, my family we all had COVID this month, and I've been kind of taken down by that. And this is such an enlivening conversation. And so much has happened since my book came out in March. And so it's really nice to reconnect with it and to feel like, the two of you have really gotten a lot out of reading it. So thank you so much for having me.
It was a real privilege to meet you, Jessica.
You too. Thank you so much.
Yep. Just before we totally wrap this up, just like a couple housekeeping quick things. There is a survey that will open at the end of the Zoom. If you can take a moment to please respond, that would be very helpful to inform our future discussions and programs. We've also got links posted in for upcoming talks. We'll be welcoming on Monday at 5 p.m. Charles Spencer, 9th Earl Spencer, who recently wrote a book called The White Ship, involving British medieval history. And then next Thursday, we will be speaking at 8 p.m. to Gabriela Garcia, who wrote Of Women in Salt, which is another very, very important book, much like this one. It's a little emotionally heavy, but definitely worth checking out. And thank you again so much, Jessica, for being with us this hour. I wish you all the best.
Thank you so much. Thank you.